responders' ability to get to emergencies. Let's go ahead and listen in.
Hear from Commissioner Harrington. The issue of safety around COVID-19, we've been trying to highlight the implications of that many Minnesotans maybe don't see, the behind the scenes things, whether that was with emergency room doctors or hospital administrators trying to manage workload for their staff. Today, we wanted to take a little bit of time to focus on another aspect of keeping Minnesota safe, public safety side of it. You're going to be hearing from a police chief, former fire chief and firefighter, and an emergency medical technician, and from the EMS side of things. These are folks that, whether it's a COVID-related call or whether it is a fire, whether you fall and turned your ankle, a heart attack, whatever it might be, or a crime call. These are the folks that you call 911 and want to respond. And they do that in their professional, the best that they possibly can. But just like so many other professions, they're being hit by COVID hitting their workforce. And what we've seen is, once we start to see a depletion of that, we've actually had a few cases, and you will hear of them, where our capacity to be able to respond was severely diminished. Now, like in so many service-related jobs, everybody figures out a way to make it work, whether it's communicating with the community next door, where it's bringing people in on overtime, whatever it might be. That's okay in the short run. It becomes much more difficult if it's in the long run. If we end up with a fire department that has 75% of their folks out on COVID, and we have a call or what they prepare for, an untenable situation of several calls at once, how do we respond to that? And how do we make sure that we're prepared? Now, those plans are being done, but it all comes back to, much like the hospitals, the surest and easiest way we can make sure that situation doesn't arise by each and every Minnesotan doing the things to stop the spread of COVID, to stop it from the community spread that ends up not only in our emergency rooms, but ends up in our fire halls and our police stations and our ambulance crews. And as many of you know, for the last several weeks, we've had federal ambulance support to help supplement an already stretched thin force of EMS and ambulance responders. So we wanted to highlight again, and I know you heard the news earlier today, unfortunately, it's our second most deadly day in terms of number of deaths. Our case positivity rate still above 12%. Commissioner Malcolm and I took some time last Friday to talk about a little more in depth on that. And we want to use today's opportunity to dive a little deeper in what are the implications where we start to see COVID hit the ranks of our first responders, and how is the state responding to that? And I think most importantly, how can Minnesotans continue to do what they're doing, trying to help their neighbors, and in this case, help our first responders be able to help us when we need it. With that, I'd like to introduce Commissioner John Harrington, Department of Public Safety.
Thanks. I'm John Harrington. I'm the Commissioner of the Department of Public Safety. And I want to highlight the fact that while for many folks I talk to, they see COVID as being a metro area thing, but quite literally, as we've been talking to chiefs of police, sheriffs, fire chiefs, EMS chiefs, this is literally a statewide issue that is affecting public safety from the northern tip all the way down to the Iowa border, and from the Dakotas through Wisconsin and everything in between. I'm hearing literally every day from police departments, sheriff's departments, and fire departments that are having COVID impact their ability to do the right thing and to protect the public. As I said, we're hearing from Minnesota departments everywhere. Although I will tell you, my first recollection after COVID became a thing was getting a call from Colonel Langer from the State Patrol, who was reporting that troopers, when they were stopping people on traffic stops for DUI and were doing the DUI procedure, were being told that the suspect was COVID positive, and they were using that as a way to try and get out of the traffic stop and trying to get out of the arrest. It didn't work. They arrested them anyway, but it was a real challenge because that one trooper now, as we're talking about, do we need to have him quarantined for a week? How long does he need to be off the road? Mike Tuskin from Duluth was another partner. The chief in Duluth called me up and said he'd had 4 guys go in on a medical call. That was his entire midnight shift, I believe, on that particular day. The person reported being COVID positive. So now, do you lose your entire midnight shift? For how long are they need to be quarantined? As it turned out, that guy wasn't COVID positive. But then later on, I'm talking to Mike, and he tells me that they've had 29 staff in quarantine up in Duluth. 14 confirmed COVID positive cases, and that he's had to basically take his department and put them on a 12-hour special schedule just to be able to make the minimum staffing requirements that he needs to be able to respond to police calls in Duluth. Both Chief Arredondo and Chief Axtell have both talked to me about the fact that their departments have seen COVID. And one of the things I think a lot of people think about when we talk about the cop part of this, they think the cops in uniform are the primary recipients. But quite frankly, the detective divisions have been hit by COVID just as hard, if not harder. Unfortunately, detective work is oftentimes group work. You sit in a room and you share notes and you're interviewing people and you're doing search warrants and you're walking through people's houses. And if somebody in that household that you've just done the search warrant is COVID positive, even with masks and even with gloves, there's still a reasonably good chance that between that and the interview room, you're going to start seeing it. Here at the state, we had the Alcohol, Gambling, and Enforcement Division, and literally the entire sworn section of that was out on quarantine for a period of time due to COVID exposure when they were out checking bars. We're hearing it from street cops, we're hearing it from sheriff's departments, and the sheriff's departments talk about it getting the double whammy of having the community spread, bringing it in, but at the same time, they have no control over the people that are booked into their jails. And there's no way to pre-test or pre-isolate everybody that comes into a jail. And so I know Hennepin County, Ramsey County, they're all seeing COVID spikes coming through the jails. And then you worry about the staff that works in the jail, the staff that comes in and out of the jail, and then those folks that are coming in and out of court, all are part of the COVID problem. As you're going to also hear, fire departments have actually been as hard hit, if not harder hit, than police departments. And if you think about how we picture our fire departments working together, they work together in units, they work together in groups, they're in a truck together, they're on a fire scene together, they're in a locker room together, gathering the gear and getting ready to go out there. And one of the stories that we've heard is the Plato Fire Department, and Chief Wood's here, where they literally had to take the department out of service due to a COVID outbreak. While we don't have any departments that are completely out of service today, 99 out of the 500 fire departments, ballpark, in the state of Minnesota have had major COVID outbreaks. That's 20% of the fire departments. And you know, I remember looking at the map that the fire marshal put together and looking sort of in the metro area, then looking at greater Minnesota, seeing where the red dots are, where the black dots were, departments out of service, but thinking, you know, this red dot down near Bloomington, I'm wondering what that's about. Well, it was Bloomington, and they had a major outbreak going through the Bloomington Fire Department. And you start thinking about, you know, the Bloomington Fire Department services the Mall of America. It's part of the team that would service the airport. It was part of the team. So major population centers are affected by this and directly affected by it. We're blessed that in most cases, the fire departments have found ways of do the workaround, whether it's mutual aid agreements between fire departments covering for each other, sheriff's department stepping in to cover for the police department helping for the sheriff's department. We're all trying to figure out how to make this work as best we can. That statewide map that I mentioned has really been a godsend so that we can sort of plan and think about, from a state perspective, how do we move the assets around the state to make sure that we can get the help to where the helpers need it. This really is an all hands on deck piece. And we're very clear about the fact that no matter how much we take precautions, it will not take very much for us to have a fire department, a police department, or EMS group out of service and unable to help the public if we don't do the right things with COVID and we don't do the right things by wearing masks, all the prevention mechanisms that we've talked about. It is a really telling, I think, statement that when I talk to chiefs of police about guys or keeping the peace or, you know, protecting the public, that one of the topics that we now on a daily basis have to have a conversation about is how are we going to make sure that all of our officers, all of our firefighters, and all of our EMS folks are healthy and well enough to go out there and do the work that we need them to do. With that, I'd like to introduce an old colleague of mine, Roger New, Chief of Police of the Eagan Police Department.
Thank you, Commissioner. And thank you, Governor, for allowing me to be here today and share the impacts that COVID-19 has had on public safety. It's touched many of us professionally and personally. Since March, my organization has followed CDC guidelines for cleaning, hand washing, social distancing, along with other rules that we've implemented. However, this hasn't stopped the pandemic from impacting my organization. We've had a number of cases in our organization, and we've had to quarantine countless staff members due to the pandemic. One of our staff members was actually hospitalized for a few days after an exposure, and it took him almost 2 months before he was able to fully recover and return back to work. We've had another staff member due to exposures, as Commissioner talked about, with regards to case investigations and whatnot, that has missed a total of 38 days of work and had one positive, and he later tested positive for COVID. In November, the pandemic has hit our agency especially hard. We had a total of 19 staff members that were impacted by the virus, which is about 20% of my staff members at the Eagan Police Department. The result of these employees being out has led to staff members' federal emergency leave time being exhausted that the federal government gave us earlier this year. We've had to change work schedules and ask people to work additional hours and work overtime. We've had to leverage technology and move to Zoom meetings or work investigations through social or through different technology platforms that are available to us. Some other impacts COVID-19 has presented for us are the way we train our staff. Everyone knows, and we've heard a lot over the summer months, that training is an important part of law enforcement, and we've had to limit some of the training that we do, and in some cases, we've just had to cancel it altogether. Our enforcement efforts have been modified. I won't get into detail as to what we've had to change, but we've had to shift those to make sure that our staff members are safe when they're interacting with community members. And most importantly, our community outreach programs that we do. We've had to suspend many of those opportunities, such as National Night Out, our Citizens Academy, and I know a number of agencies are participating in mental health response teams to meet the needs of citizens. So these are truly some challenging times that we are faced with. But one of the biggest unintended consequences that I think many of us in law enforcement have experienced is the challenges and the stressors that it presents at home and the impacts on our families. And, every day a police officer goes to work, such as just as the medical providers, the paramedics, and the firefighters, we all risk bringing that virus home to our families, and it creates stressors in the stressors at home. And I just simply would like to offer my thanks to the family for their support in helping support law enforcement officers get through these challenging times. In closing, I would like to thank healthcare providers, paramedics, firefighters, and all the members in law enforcement throughout the state of Minnesota for their courageous efforts. Just know that it's appreciated. We probably don't say it enough as leaders, but just know that it's appreciated. These are truly some challenging times. And on a personal note, on Thanksgiving, I lost a dear friend and a community member named Larry to COVID-19. One of the last things that Larry did was he called a number of his family members and he asked them to stay at home, wear a mask, and be safe. I would like to extend my condolences to Larry and his family. And I would like to ask everyone to please do your part to help us get through these challenging times. Thank you. The next presenter is Jay Wood.
Good afternoon. My name is Jay Wood. I'm a 26-year member of the Plato Fire Department, the retired fire chief as well from there. Plato is located just west of the Twin Cities in McLeod County. We are a 20-person all-volunteer fire department. We service an area of roughly 40 square miles and 500 households. From the very beginning of this pandemic, we have followed the guidelines that the governor has set out and continue to follow those today. But just like we preach about fire safety, one little spark can cause a fire. And that's exactly what happened to us. COVID-19 sparked an outbreak at the Plato Fire Department. Before we knew it, over 3/4 of our fire department had been affected in one way or another from the virus. Either positive, they were tested positive, or they had been exposed. With that being said, affecting 3/4 of the fire department, our fire chief, Jamie Schlechter, had only one decision he could make. He had to make that decision to take our fire department out of service. We relied on our mutual aid partners, our EMS association providers in our area to provide coverage for us. We train with these people regularly. We go on large incidents with our neighbors for fires and accidents and whatever it might be. We know how well trained they are. There was no disruption in service to our community. When the public calls 911, they're more concerned about the fire truck showing up for help. They're not concerned about the name on the side of the fire truck. Mutual aid is something that all fire departments participate in statewide. It's a great system and we all work together. Fortunately, the Plato Fire Department is back up and running and most of our members are back to full service. We are not alone as a small department of dealing with the virus and the staffing issues it has presented us. Fire departments throughout Minnesota are facing this, whether they're large career departments or small volunteer departments. The Minnesota Fire Service is always here to help the public. And people always say, what can we do to help you? The biggest thing that the public can do to help the fire service and all public safety is to follow the guidelines that the governor and the Department of Health has set out. If we follow those guidelines with wearing a mask, social distancing, limit our gatherings, it will help keep all of us safe. Furthermore, as we head into the holiday season, this is a time where it's very dangerous for fires. And we really recommend people take the fire safety procedures very seriously over the coming weeks and months. All right. And if you have questions about that, the Minnesota State Fire Marshal's website has a lot of tips on fire safety during the holidays. For first responders, help is right around the corner with the vaccine. The vaccine will prove to be an important tool to firefighters, just like our fire gear is there to protect us when we enter a fire. On behalf of the Minnesota Fire Service, we want to thank Governor Walz, Commissioner Harrington, State Fire Marshal's Office, the Department of Health for all they have done to assist Minnesota's 20,000 firefighters to keep us informed, prepared, and safe in these unprecedented times. As the Eagan Police Chief talked, he lost a friend recently to COVID, and I can speak the same way. I lost an older friend that was of value to me personally, and as his family grieves his loss, I would keep them in my thoughts and prayers as well. Stay safe, Minnesota. And now Ross Chavez.
Good afternoon. Thank you, Governor Walz, Commissioner Harrington, for inviting me here today to provide an emergency medical services perspective, an ambulance service provider's perspective on COVID-19. My name is Ross Chavez. I am a 911 paramedic here in the Twin Cities metro area. And like my paramedic and EMT colleagues across the nation, it is my passion to provide the best pre-hospital care to the sick and injured, even when challenged with something as extraordinary as COVID-19. Despite our best efforts, there are times when we get exposed and we also have to go on quarantine or isolation, and we have to stay away from work while we're being quarantined or isolated. And this can often create staffing shortages, and those staffing shortages can lead to fewer ambulances available to respond to the 911 calls of our communities. While there may be a larger pool of paramedics and EMTs here in the metro area to pull from and fill those gaps, that's not always the case. And especially when we're talking about areas of rural Minnesota where they don't enjoy as large of a pool of EMS staff to pull from. Regardless, the additional fatigue and stress that's placed on those of us who are called to fill those gaps, it's challenging at best and unsustainable at worst. The Minnesota EMS providers, along with our partners in emergency telecommunications, fire, and law enforcement, we enjoy and appreciate the incredible support that our communities have demonstrated during these extraordinary times. We're often asked by members of our communities, how can we help? And my answer to that is please help us help you by following the advice of our public health experts. As Jay Wood alluded to, following these guidelines, doing such will help us stay healthy so that we can respond to the emergencies of our communities in a timely fashion. You'll help prevent our hospitals from being overwhelmed. And in that way, our ambulances won't have to travel longer distances to get patients the care that they need. And by traveling longer distances, leaving our communities without these critical resources for extended periods of time. And while we do have these mutual aid agreements with our neighboring communities for when your local ambulance may not be available, it does take time to get a mutual aid ambulance to your community for your emergency. And sometimes this time is significant. And in critical illness or injury, it can be the difference between a good outcome or a bad outcome, or even life and death. You know, we've made a lot of changes with how we as EMS providers operate on a day-to-day basis from in order to keep ourselves safe. And that includes exhaustive personal protection equipment and infection prevention procedures. And it also includes how we interact with each other as an EMS family at our stations. We've made sacrifices, and we can now just start to see some of the light at the end of the tunnel with the vaccine on the horizon, but we're not quite there yet. We've all made so many sacrifices, all of us in Minnesota. And I think that by continuing to work together, we'll be better equipped to keep each other safe through this winter. It tears me apart to watch family members say what they believe will be their last goodbye when I wheel them to the ambulance on a stretcher with either confirmed or suspected COVID-19. And the look of fear and uncertainty in their eyes, it's really indescribable. And it pains me even more to think about having to miss work because of being on quarantine or in isolation and not being able to be there for those patients on one of the worst days of their lives. So please help my colleagues and me to help either for those who need us, especially during this holiday season, during these trying times. Thank you.
Thanks, Russ. Well, on behalf of myself, my family, and I think all Minnesotans, a thank you to our first responders. I think most of us know we hold them in high esteem, and you do hear people, and they mean it. How can I help? How can our thank yous? And they show that. How do I back the blue? How do I back the red? How do I back our EMSs? And I just want to be clear to Minnesotans. I am not naive to how politically charged this issue's gotten. So I started last week, and I'll continue to say this. These folks, there, no pun intended, Chief, there's a firewall between the politics and what the public health policy is and what first response should be. We should be able to be agnostic about that and still look at the facts of what it takes. So I want to just reiterate the point I made last week. They are not here to endorse any position of mine. I am here to make sure that we're following the best guidance and doing what we need to do to provide them the services. They need to be ready to respond to a police call, an EMS call, a fire call. They need to have all of the resources necessary. We clearly, every year, try and do what we can to give them the right equipment, to make sure that their gear is the best possible, to try and give them those tools. This is another of those tools to protect us, but we owe it to them to protect their family. So I'm grateful for your stories. I'm grateful for the work that's been out there. And I think it once again to illustrate to Minnesotans the complexity and the impact that COVID-19 has. But once again, the virus doesn't care if we're tired. The virus doesn't care that we have political fights. The virus doesn't care about any of that. But what we can do, and the virus is impacted by, how we behave, how we treat this virus, how we wear the mask, how we socially distance, how we wash our hands, and how we stay home if we're sick. Again, these frontline folks are put in that. You heard the example, just a traffic stop. These are the folks that have to be on the front line. They have to intersect with folks. And the more community spread we have, the odds go up greatly that they're going to intersect with someone who has COVID. So with that, we'd be glad to take any questions. Esme, we'll start there. Yeah. The question for everyone is, again, I'm going to have Commissioner Malcolm maybe be a little more. I'm getting all of the acronyms down, VERBCO and all of these from CDC and FDA. It's exciting news. What happened yesterday was a meeting on the ethics and the folks that will be part of putting out the recommendations for how do we roll out the vaccine. We've been talking about this, that there's going to be complexity around the supply chain. There's also complexity around who gets it first, who makes the biggest impact. How are we determining that? And this board is making a recommendation of 1A. And again, we're just getting this information. The letter you're referring to, I was provided to me just this morning, and we were talking about this. The question was, should first responders be part of that 1A? I think they were designated 1B. Is that correct, Commissioner? Which means they're part of the first group, but not the very first group that gets it. And the issue here was, and I mentioned this a little bit, I believe yesterday, or was talking about it, that there's several schools of thoughts. Do we vaccinate those over 65? Or do we start out by vaccinating those who are in emergency rooms and those in the medical profession? And what came out of yesterday's meeting was I think they targeted 1A as medical professionals and designated inside the medical profession those most impacted by COVID or most in contact with it, and nursing homes. They put firefighters and other first responders in 1B. What we are going to be asked as the state to follow that guidance, to follow the ethical requirements, and roll out our plan on how we will do that. And I think, again, these are decisions that need to be based on the science. They need to be based on the best practices. They need to be based on the ethics. This is not a decision that the governor makes or the governor make alone. But for that being said, from a personal perspective on this is, I think it makes sense to get these folks as quickly as we possibly can, because of the very reasons we're talking about today. If we can get protections into our police departments, our fire departments, our EMS, they're going to be able to respond to all of those myriad of issues. So Jan, I don't know if you want to add anything of where we're at on that or how this will look. I think we are still planning on briefing this entire group in great detail sometime early next week on this. That hasn't been decided yet, and I think like we just got the guidance last night, and we're digesting it of what it means. Commissioner and I haven't even had the formal conversation that we'll have about what those results mean. They're sent to me, and I'm reading it. So,
thank you, Governor. And just to clarify, unless something's changed in the last few hours that I'm not aware of, we're actually required to follow the 1A, 1B, 1C framework that the ACIP laid out. We will have some ability to, from a Minnesota standpoint, prioritize within that. Obviously the field of healthcare workers is very broad. So our Minnesota group, which we've talked about, that will advise us, and we in turn will recommend to the governor, will be looking at things like within that broad field of healthcare providers, are there subsets of that would be prioritized first? And one can easily imagine that would be, more the people that have the frontline contact with COVID patients. But in terms of the 1A, 1B, 1C designation, our current understanding is that we are required to follow that federal framework.
Question. How many people are in Minnesota are in that category of 1A healthcare workers? And do you have a sense of how many vaccines Minnesota will get in the first wave? I know proportional to the adult population. How many vaccines will Minnesota get at first? How does that compare to the number of people in that 1A designation?
It's a great question. I don't have those data with me right now. We could probably get that for you this afternoon, but definitely we can talk about that when we do the in-depth briefing on Tuesday. But I'll see if I can get you that answer yet today. Yes, I think. Thank you. Yeah, I think that's a fair conclusion. There are more providers in these categories than there will be initial doses.
Yeah, all that we're starting to get. I would just add, and again, my focus on this is them being in category 1 is critical. I would say, from my perspective, I agree with that categorization. And again, I think the commissioner's right. Looking in the medical field, we may prioritize dermatologists further down, and there may be the ability, and Jan, I do not know if this is the case, if 1B at the top of the 1B list gets in there before the bottom of the 1A folks on that. Those are things we have to figure out how that works. Yes,
Governor, what's your response to Minnesotans who are doing all they can to follow the guidelines, the rules, and who are very frustrated because they see many people are not doing that, and they're not
masking or keeping socially distant without any apparent consequence.
Yeah. Well, I would argue there's moral hazard there. My job was never to shame people about this. My job certainly, as I said early on, wasn't to try and arrest people or issue fines. My job was to use this office and the authority that was vested in me and the best healthcare guidance to try and put out policies that would save lives and then try and put those into the public. This one has been a tricky one. I got to be very honest with you, because you've got folks saying, well, what about these folks? Nothing happens to them. They don't do anything. And to be candid, folks see that right in front of my house. The folks who don't want to wear masks purposely gather as close as they can and stand in front of my home, and nothing happens. And the part of it is, it was never about arresting them. It was to try and make it. I go back to this moral hazard piece. I hope people are starting to see the decision to not wear a mask or to gather with your neighbor to watch a football game is putting these folks at risk. I think if you're in public on that, you should feel not really great about that. It's not me telling you that. It's them telling you that you know what, you're making our job harder. You know, you're flying I back the blue flag. Well, then show us you do. Show us you do by protecting these folks and getting them there. So I hear this frustration. I would ask those that are following this, like so many things, you don't follow the law because it's a law. You follow it because it's morally correct. We don't need a law for the vast majority of people to not commit murder. They would never do so anyway because it is morally reprehensible. And this is one of those cases. I don't know, again, there'll be a lot of books written about this over the next century, how we allowed this to become politically charged. So I would ask those folks, stick with it. You're right. We're not going to be able to arrest everybody. Certainly was never our intention. I would ask those folks again, like I've said before, you don't have to follow these rules because I said so. You don't have to follow them because you don't like government. You should follow them because they're the right thing to do. They protect lives. And to be honest, they get us back to normal so you don't have to worry about that. I'm hopeful that these folks who stand in front of my house without masks have other things they would rather be doing. They're trying to make a point, but that point goes against the best health guidance.
I have a question.
Yes.
Really aimed at speakers. Today, the CDC has discussed the issue of shortening quarantines from 14 days for people who have been exposed to the virus, potentially 10 or even 7. But they acknowledge doing so, this would slightly increase the risk. Let someone else short quarantine of exposing others. Our state hasn't decided whether to adopt that. I guess I'm just curious whether you would accept that risk for your department, whether it would be easier to work with short quarantines.
Yeah, I'll let the commissioner. No, it's a very good question. The question was about CDC's guidance of today of shortening the quarantine period. Actually, we've been looking at this for quite some time, and I brought it up because Germany was doing this. And the theory behind shortening the quarantine period time is that you're still risky during that 14 time period, but it reduces over time. And that it's a trade-off, like so many of these things. If you reduced it to 7, you would get far more people that would comply, and the risk would actually go down, even though some of those people would still leave contagious after the 7 days. Am I explaining this correctly? Health officials, I, again, do not want to, the commissioner will speak for herself, find this a little bit dicey to fall into this territory. And it is an ongoing healthy discussion we've always had that the best laid health guidance, but if I can't get compliance for it, it doesn't work. So I've got to figure out that sweet spot to try and figure out how do we gain compliance while still following the science, reducing the number of infections. So this whole debate about the time period of the quarantine is about that. Germany found out that if you reduced it to 7 days, more people followed it and infection rates went down. Now, the health guidance would tell you you should go to 14 days. Now, what I don't know is with a high amount of community spread and positivity, does that negate what you would gain by going to 7 days because of the volume? So Jan, maybe I'll have you.
Well, Governor, you did that terrifically well. I can't improve on his explanation. I'll just tell you that we just got this morning, and our team is looking at the details as we speak. So we're not prepared to say today to what degree are we going to just follow the CDC recommendation or adapt it in some way, but we will do that in the next couple of days. We're really eager to see what data there are, as the governor just indicated, if there's any insight there into where that, how that trade-off might change depending upon your your prevalence in the community. So it is a really, kind of a just yet another example where things aren't maybe as straightforward as they might appear on the surface, that you really do have to think through that trade-off between shorter quarantine, better compliance, and shorter quarantine, some added risk, particularly in a high prevalence situation. But we'll be back to you just literally in a couple of days with our answer on that.
The approach in my community has been to start from a place of abundance caution and really leverage the federal leave time that's been given to employees. We are actually working through the new language that's, in fact, there's a group of my staff members that are back at the police department as we speak, sifting through the language and trying to determine how we apply that to our organization. But one of the things with these changes is they've been pretty constant throughout this pandemic, and we're trying to keep up with it. But again, we start from a place of caution first and foremost, not only for our staff, but for our community members as well.
Thank you, Governor. In the fire service, we do a lot of risk assessment, risk versus reward, especially when we go to a fire. And what are we going to risk and what's going to be the reward? And I think the same thing would be said about the shorter quarantine time. What is going to be the risk and what is going to be the reward? And I think the fire service will continue to follow the governor's recommendations, the health department's recommendations, and do what's best for all of us. Thank you. Thank you. Yes, in Plato, we have our full department is all recovered. I guess I should say we have 2 people that are waiting to come off quarantine. I think tomorrow is the day that they'll be off. We had one firefighter that was hospitalized, and we were really worried about him at first, but he's doing remarkably well.
As I mentioned, we had the one staff member that was out for approximately 2 months recovering from COVID. He had a short hospital stint, but is fully recovered. Currently, we have 3 staff members that are on quarantine due to exposure, and another 3 staff members that have positive cases, but by all accounts, they should return to work after the 10-day isolation period.
1A would be getting possibly the vaccine, and 1B would be getting the vaccine. And then also, for those of you who are staff, do you think your staff is going to be excited about getting the vaccine? Obviously, you represent different areas and different things. Do you think you'll be looking forward to getting it?
I'll take the first one, then somebody can come on this. The question was about timeline on the vaccine. We're still functioning. I think most of us saw the news today that in the UK, they approved Pfizer for emergency use, which means I would assume it sounded like by this weekend, they'll be starting to do the vaccinations in the UK. We are still under the assumption that we're hearing the 11th. The December 11th is when that will be granted. We believe, and Commissioner Malcolm can help me on this, that it sounds like the first initial shipments will be coming, could be as early as next week. They may be on the ground before the 11th, but somewhere in that time frame, and then the execution of the plan. I think we always thought that a best case timeline would be somewhere around Christmas. We'd be able to start doing that, and I assume, Commissioner, that's about where we stand today, but nothing more specific. Our hope is, Esme, that over the next week or so, and especially as we get to the 11th, we'll have a lot tighter timeline. And then we want to, as this information is coming out from that meeting yesterday, we'll start operationalizing that here. And keeping in mind, private hospitals are going to be part of this. CVS pharmacies are going to be part of this. It is a broad network, and then the state will be part of how we do this. I think the state, we're looking at how do I get the 38,000 state employees I'm responsible for, and we have flu clinics already set up. I believe we're going to follow that model, and I know there's a lot of folks thinking that way. So hopefully by this time next week, we should have a pretty darn good timeline on that. But it's at this point in time, it's out of our control. It's still federal side of both approval of the emergency usage and the shipment of the vaccine.
Is that the day the first medical person could get the shot in the arm, or this would?
I think potentially that's the date they show that FDA has to do the formal signing. Is that Jan? You want to?
Yeah, the 11th is when we anticipate that the FDA will issue the emergency use authorization. So the shipment of the vaccines wouldn't begin until after the authorization has been granted. The CDC's advisory committee will meet again after the FDA authorization is granted to kind of formally make those prioritization recommendations. So what we learned about yesterday is not necessarily the full and final answer yet in terms of federal guidance. One other thing that I know my colleague Chris Erzman mentioned when we talked about this yesterday on the media briefing, we will need a little bit of time once we get the specific emergency use authorization criteria, like is it approved only for certain groups? Is the timing schedule different for other groups? There's a lot of detail that will be in that emergency use authorization. So after we know that on the 11th, then there'll be some training needed. You know, as the governor indicated, this is a very complex distribution plan, a lot of people involved in it. And so training the folks who are going to actually do the immunization on the details of the EUA will take a little bit of time. So I think the governor's right on that about a week from today, we should have a more precise timeline to be able to offer you as to when people are actually going to start being able to be vaccinated. Correct. Yeah, thank you. Just to be really clear, the federal approval is what happens on the 11th. Vaccinations will start, some week or so after that, we would think.
Let's do follow up on Esme's question about this is one I think does need to be addressed. Your question was how confused are people getting?
Yes, how confused are they? Are folks in the 1B category, including obviously
Esme, at this current time, I can't tell you definitively how many of my staff members will or won't take it. I think there's a lot of layers that we need to work through, obviously. There might be medical issues that someone might have, and I think we need to understand a little bit more about the vaccine. I think the governor framed it best. We don't want to shame people, but I think we'll do our best to try to encourage people to do their part to take the vaccine. I can tell you personally, I plan on taking it when the opportunity presents itself.
I'm not able to speak to specifics of an agency, but personally as a paramedic, as a 911 provider, I will be first in line to get a vaccine based on what I've read from the data, the research, what other public health experts, vaccinologists, epidemiologists are saying about the safety of the vaccine. I'll be first in line.
I echo his sentiments that I'll be very anxious to get it myself. I think that by reading the letter from the Fire Chiefs Association is a unified group of firefighters. They're all excited to get the vaccine. I'm sure, like any organization, there will be some that either morally or ethically religious views they might not want to take the vaccine, but a lot of us always have pre-employment vaccines that we're required to take. So my hope is that more will be excited than not.
Another question for Ross. I was curious about how COVID and its prevalence is affecting your work as an EMS and your response times. Since everyone's possibly a walking COVID case, does that complicate your response, delay your response? I was wondering if you could talk about that a little bit.
Sure. I think that across Minnesota, the EMS agencies, ambulance service providers have, especially probably since September when we've seen the rise in cases, we're basically treating everybody, every call as if COVID is present, and using the PPE recommendations that are recommended by our EMS medical directors, by the CDC, and by MDH. And, you know, at times it can slow things down, donning full PPE to go into somebody's home and determining what exactly is going on. Decontaminating the ambulances after each call takes a little bit of extra time. But I think that these are very important steps that to keep us safe and to keep patients safe. As you know, the back of an ambulance is not very large, so it's a very confined space. Making sure that we're providing a safe environment for every patient that we encounter during those shifts. And you know, as far as cases amongst colleagues of mine across the metro, you know, I think a lot of the cases have been community spread, which is an example that the personal protective equipment that we use on the job, it works and it keeps us safe from these patients that we come into close contact with in a confined space for prolonged periods of time. But yeah, it has added some complications and challenges to our day-to-day operations.
Once again, I'd like to thank all these folks, and to Minnesotans. These are your not only first responders, these are your neighbors. And again, when we talk COVID, we sometimes get into numbers, we get into details, we get into plans and actions. It's about protecting people. That's what these folks do on a daily basis. It's what this whole fight about COVID has been. It is not about to impose anything on someone. It is not about to make life more difficult. It's all about trying to follow the science to slow the spread of a global pandemic that has killed nearly 3,700 of our neighbors and sickened tens of thousands. So we wanted to highlight these stories. I think right now you hear this talk and it's exciting. I mean, imagine going clear back to March, imagine when we're talking about approval of the vaccine in a week. That didn't even seem like that's something that could happen then. No one knew. We were talking years and years. And I do want to note the concerns around safety of the vaccine. The United States this is always a concern. And I've said it from the beginning, for my critiques of what has not been done well at the federal level around COVID-19, there has never been a critique around the vaccine, communication with us, development, and all of that. My assessment of that from a governor's perspective is that they have done a fantastic job at that point in time. I trust that the systems are in place and the safeguards are in place and the redundancies are built into the FDA and the CDC, and that good and smart people will help make these recommendations. And in Minnesota, we believe we have as strong a plan as anywhere in the country to be able to distribute that to folks. But my caution to you is that excitement can make it look like this thing's just about over. We are right in the teeth of it. 77 deaths today. And again, you know what we say. The math is relentless. Hospitalizations follow cases. Deaths follow hospitalizations. We've gotten better at reducing all of those things except the spread. And that's the one we have the most control over right now. So again, it's a tough time. We're into December. We dig deep. We're literally looking at the vaccines arriving to us and discussing who's going to get them and when. That is a game changer. But let's make sure we get all of our neighbors there. Let's make sure we protect those folks that make a difference. And today I'm asking you, if you're thinking about wearing that mask or you're thinking about whether to go to that little gathering, stop and think about that firefighter, that police officer, that paramedic, and give them a little bit of a break today. Make their job just a little bit easier. Keep them on, because who knows, whatever the incident is, God forbid, a traffic accident or a health emergency unrelated to COVID, we need them and we need them ready. So thank you all.
You've been listening to Governor Tim Walz and other state leaders discuss